If you were at the Global Symposium last year, you might remember this slide. And I think the talk we're going to have today about the European Symposium really drives this home, is that we're here to generate evidence that promotes better health decisions and better care. Next slide. So I didn't put the one talking about how hard that can be, but in order to achieve this goal, if you guys remember, last year we initiated the Save Our Sisyphus Challenge, where we worked together to try to answer 4 different clinical questions that were led by different community members. And as part of that effort, the goal that I had for us as a community was to start to build out our OHDSI Evidence Network, meaning a network of databases that are ready and willing to participate in research, to answer these clinical questions, to generate evidence. And we wanted to do that by gathering some, simple aggregate statistics about databases in the network, so we could quickly and easily identify those that might be fit to answer clinical questions of interest like these 4 here. Next slide. And so, as I talked about last year at the Global Symposium, we had this fabulous group here of the inaugural data sources, and I'm calling it of the OHDSI Evidence Network pilot. This is fantastic, and it was such a journey with these folks, and I was really appreciative of the work that they did to build out this initial version of our OHDSI Evidence Network. One of the other things we did at the Global Symposium was we actually brought many of these partners together, and we were talking about, what worked and maybe what didn't work about this pilot version of the network. Next slide. So what we learned as we went through this is that, we have some aggregate statistics. We want to learn about our network. We want to share some information about our network with the world. But in our inaugural version, we were actually keeping those statistics private. And that was for a lot of different reasons. But by doing that, if a community member wants to initiate a network study, then trying to identify databases that can help answer those questions actually becomes a bit challenging because there's a bottleneck. You have to reach out to someone, maybe me, maybe someone at the OHDSI Coordinating Center, who would then facilitate that interaction between the person who has the question and then trying to identify the data sources that might be fit for use. And that can actually be a barrier to open science. We found it was a bit challenging. The other thing we heard from data owners is that they were hoping to collaborate between other data partners to better the quality of their data. They wanted to learn from other people who have data, who are willing to participate in studies, and they wanted to use those learnings to improve their own data. And as well, we learned that data owners wanted to understand how their data compares to other sources in the network. We actually find we can learn a whole lot from each other, just figuring out, oh, I have data in a healthcare system that is similar to, someone over here. And how does that look? And maybe can I learn from them about how they are mapping their data, how they're working with their data, and maybe, again, better the quality of their data. And we can all, be generating better evidence together by learning from each other. The last one that we heard a lot was that having a protocol, putting this into the context of a network study, would make it much easier to get IRB and governance approval. One barrier we definitely recognized was by not having a protocol, even just to share with, say, upper level management in an organization, not having something to point to say, this is what we're doing, this is how it will benefit research, this is how it will, help us move forward, could, sometimes be a barrier to folks joining the network. So over the last few months or so, Paul Nagy and other members of the OHDSI Evidence Network working group, we've actually been putting together a protocol in response to a lot of those learnings we heard from the inaugural members of the network. So we would like to actually introduce this evidence network study today and invite you all to join. So what you will do, and if you follow the link here in the QR code, and I will share it in the chat in a bit, it will take you to a Google form that will ask you just a couple pieces of information, really just your name and the name of your institution. And once you fill that out, you will get a link to the protocol. And our hope is we can continue the work we started last year. And now with a full protocol, we're hoping many, many more people can join. And one major exciting piece of this protocol is that we've written it in such a way that we can make this a truly open network, that we can make all this information we're going to collect from around the community open and available to anyone who might want to interact and use the network for their own research purposes, so we can really continue our journey of generating evidence together. Not only that, but we are looking to actually write a publication together describing our network and those members, and really help introduce the world to what we are capable of as a global consortium or network, or whatever word you want to use. Our global community is fantastic, and we really want to push this forward and express to everyone just how amazing we all are and what we are doing together to better health decisions and healthcare around the world. So please join. I will be sending out lots of emails and notes to everybody asking you to join. So if you don't hear from me, please reach out. But I'm very excited. And as Craig put up, we have a meeting at 10:30 a.m. Eastern on Thursday for the OHDSI Evidence Network working group. So if you would like to actually work behind the scenes and help us pull this entire network study together, please join that working group as well. And I will put a link to the form to fill out that Elise so helpfully manages, so that, if you want to just help move this forward from the study perspective, we would love to have